Joining me now is a man who is an actually great congressman. Lord knows we need more of those, and it's not just because he has an amazing name. His name is Mike Kelly, congressman from Pennsylvania, and his new law he's proposing is a mouthful, so I'm going to read it, Congressman, if you excuse me a moment.
That's fine, Jess.
The headline is this. Kelly, I like that part, introduces Essential Workforce Parity Act to support healthcare heroes during coronavirus pandemic. Congressman, what does this law do?
Okay, you know what, Jess, what we found out is that during the CARES package and things that we put out, there was a piece of that act that said, look, if you if you're in the workforce, you can be away from the workforce. You can take the leave. You'll have an unpaid leave, but you'll still be able to protect your job, except for one thing. If you're in the healthcare workforce, you can't take that time off. You're going to be handled differently than the other parts of the workforce. And you think, well, wait a minute. So we refer to these folks all the time as angels. We refer to them as heroes. And then we say, but when it comes to treating you the way we treat other workers during the pandemic, you're going to be treated differently. You're not going to be able to take that time off. Maybe you're sick or you have a loved one at home that you're going to take care of. In those cases, you're not going to have some of the same safeguards that other workers have. So there was a disparity there. So, geez, the people who are on the front lines, the people who are subjecting themselves more than other folks to this exposure are being told by the same thing as you're not going to be given the same workforce attributes that others are. And I think what we were worried about is, my goodness, if we're going to protect people, let's make sure we're protecting those who protect us and those who serve us at times of need. So, the whole idea behind it was to take a look at legislation, well intended, was not fully thought out. And in some cases, if I'm a nurse, if I'm a healthcare provider, if I'm an ambulance driver, and somebody in my family gets sick and I have to go home to take care of them, I'm not going to be given some of the same leeway that other people are in the workforce. So all we're trying to do is level the playing field, make sure it's fair for everybody, and give these folks the same opportunity. Now, Congress, in its wisdom, and I do mean this sincerely, in its wisdom said, well, if you do that, we're going to lose too many people in our healthcare workforce, and we don't want them to be able to do that. And you think, well, that's kind of upside down thinking. Let's make sure we level the playing field, and folks that need to have that time off, they get the same workplace protections as other people do, and the ability then to be off and then come back and your job's still protected. That's what it was all about. The other part of it, Jess, is on protection from frivolous lawsuits that I think we all know in this litigious society that we're in. You know, you could be doing the right thing for the right reasons to help people and find out 4 months later or 6 months later that all of a sudden there's a lawsuit filed against you because somebody feels that you didn't do something right during their period of being sick. And it was a problem. No, look, for bad actors, for people that do have a major problem, we have to have safeguards in place and we have to have oversight. But we want to reduce the availability to just frivolous lawsuits.
Now, Congressman, what does it actually, the idea of it, as you know, the devil's always in the details. What does it do? Is it a federal law mandating this employer must do this employer must do that? What does it actually do for these healthcare workers?
Well, what it does, it gives these healthcare workers the same privileges, the same oversight that every single worker has now. They were the only ones, Jess, that were singled out. And so what it is, you know what, let's make sure that we're calling them heroes. We're calling them their angels. They're the people that were there when we needed them the most, put themselves in the most danger, that worked longer hours than anybody expected. So why would you all of a sudden tell them they're not entitled to the same privileges and the same coverages that people in the regular workforce are? So, for instance, you're working on a job and you have a problem at home. Well, you're given that window of opportunity to go home and help that person who's ill without affecting your workplace being able to come back to work. All we're trying to do is just level that playing field, give our people working in healthcare the same coverage.
Hey, thanks so much for watching The First on YouTube. If you liked what you saw, go ahead and like and subscribe. You heard me. Like it, subscribe. You'll get a lot more of it and a lot more of me.